Hi, everybody. Happy Thursday and welcome to Chai with Cheruba. Today, I'm in a different space. I'm actually in my office and there's boxes and stuff all over the place. And I'm going to tell you why. But please grab your chai. I have my bottle of water today with me. I'm usually not in the office on Thursdays. So this is new, but I'm looking forward to sharing some important updates and talking about some myths about being a member in my practice or being part of my practice. So please tag a friend, invite a friend, grab your cup of chai, and take a seat. And I'm happy to be here today, and we'll also answer any questions. So we'll wait just a few more seconds for people to join. Okay. All right. So, hi, everybody. I'm Dr. Prabakar. I'm an OBGYN, and welcome to Chai with Cheruba. We've been doing this series for a while, and today it's going to be a little bit different. I want to share some important updates. I am in my office right now with all these boxes behind me. It's a mess because I am moving to a new space. And this is a bittersweet moment. Today is my last day in the office, and I'm seeing patients, and we are moving to a larger space, a bigger space, to continue the mission and the vision of our practice, which is to, just give world-class treatment and care to our patients. So I want to take this opportunity to talk about 3 myths about being a patient at my practice. And when I started this practice, it was a new model for gynecology. People are not used to paying cash or paying out of pocket for their GYN care. Historically, people have paid extra money to a dermatologist or a plastic surgeon, to do various cosmetic things to their face and body. But when it comes to, regulating hormones, taking care of your GYN health, your metabolic health, paying out of pocket has just not been a thing. So however, we are seeing a revolution in this space in medicine. And almost 3 years ago, I decided to leave traditional corporate medicine and start my own private practice, which was out of network. And frankly, I got a lot of hate for it. There were people who, including doctors, who didn't understand what I was doing or why I would do that, told me right out that I was going to fail, even really well-meaning people, including my mentors. And so it was a really interesting time. But you know what? I bet on myself. I didn't know anything about business. So I say this from a place of vulnerability and as an encouragement to other doctors who, feel trapped in corporate medicine and want to do something different. But I acquired all those skills. I started this practice, and it was slow to begin with. There were hardly any patients, and I was thinking, what am I doing? Like, is this going to happen? Is this going to work? But here I am 3 years later, almost 3 years later, and I am growing out of my space. I have become so busy. I have hired another doctor. We are expanding our space. We're doubling our footprint. And it has been a wild success. And I can't wait to see what the future holds. And so I wanted to share with you a patient story that really embodies what my practice is all about. And I'm going to talk about the top 3 myths. I'm going to get there about being a patient in my practice, because I've heard all sorts of things from patients over the years, and many of them are misinformed until they come here. So I wanted to just go over that. So when I first started this practice in 2022, it was about 2 months in, I got a call on a Friday afternoon from a patient who used to see me at my old practice, but she'd never been to my new practice. She hadn't established herself here, and it was a Friday afternoon, I remember, and she said, I feel a lump on my breast. Is there any way I could come and see you? You haven't seen me in your new practice. You haven't seen me in a year, actually. But is there any way I could see you? And I was like, yeah, come in. So she came in. She established as a patient. I examined her, and I felt this lump in her breast, and I said, hey, I don't like this. Like, I know you just had a mammogram and everything, but this is not feeling normal to me. And of course, we're thinking breast cancer. She's really freaked out. And she was like, oh my goodness, where am I going to get, an appointment? So it was a Friday afternoon. I texted two of my friends who are breast surgeons, and I got the patient in on Monday. So she was able to see a breast surgeon, get a biopsy. Yes, it was confirmed that she had breast cancer, and her treatment immediately was started. And 3 years later, she's doing great. And this patient was so grateful because she would have traditionally waited weeks to get an appointment, right? But instead she was able to see me right away. So she was able to see me right away, get her biopsy and get her diagnosis and move on with treatment all within a period of 7 days. Versus in a traditional setting, she would have been calling different offices. She would have waited weeks to get an appointment, and then she would have seen her doctor. They would have said, okay, I'm a little concerned here. We need to see a breast surgeon, and then potentially waited another 6 weeks, 8 weeks to see a breast surgeon who would have then scheduled a biopsy. It would have been months before she got her diagnosis. And nobody wants to wait on a breast lump or, some concerning thing that is going on in your body. You don't want to wait 3 months, 4 months. You want to know answers soon, right? So this was the care that I was able to provide. And there's just so many more stories. And so this brings me to the point about top 3 myths about being a patient in my practice. Okay. Number 1, you have to be rich. Okay. This is something a patient literally told my medical assistant on the phone when we were trying to, answer her questions and get her an appointment. The patient said, oh, so you guys are just for the rich people. And this is absolutely not true. But who we are for is for anybody who puts value on their healthcare. Okay, that's who we're for. We don't really concern about ourselves. We don't concern ourselves about what's in your wallet. Okay, that's not our problem. We are here to provide great care for whoever puts value on their healthcare. So my patients, some are wealthy, sure. There are patients who are stay-at-home moms. I see a lot of students, who are in local universities who don't have a doctor and just want to get in quickly to be seen because they have something concerning. I see, small business owners. I see all sorts of people. I see tech people, some of whom are wealthy. So, whatever. I see everybody. I see people from all walks of life. And I see people for whom money is not an issue. I see other people who literally count their dollars and bring me cash to be able to pay for their appointment. Okay, so I see everybody. And that is not my concern at all. That is actually none of my business, whether you're rich or, what your financial status is. If you value your healthcare, if you want to be seen on time, if you want a great network where you can get in if you have a problem, if you want somebody to listen to you, if you want your doctor to spend time with you, then you're at the right spot. Okay, so that's the first myth, that you have to be rich to be my patient. Okay, number 2, you have to pay a large annual fee. Okay, that is a myth. You do not have to pay a large annual fee to be a part of my practice. Now, let me break this down because this is confusing to many. People think I'm a concierge doctor. And concierge means, typically in this space, it means that you pay an annual fee. Okay, that fee may be $2,000. That fee may be $5,000, $10,000. 50,000, whatever. And then you pay that fee upfront and then you have unlimited care. Okay. That is not my model. Okay. So my model is pretty much you pay as you go. So if you see me just 1 time a year, you just pay for that visit. That's it. If you see me 5 times a year, you pay 5 times for whatever issue you're seeing me. So you don't need to spend thousands of dollars upfront. We do have an option for those who want to be members to do that. because some people are like, okay, I want access to you. I want to be able to text you. I want that. I want that access with my gynecologist. I travel all over the place. I just want to be able to ask you a quick question. I want to be able to come in a few times a year. Sure. So we do have a few members, but that is not our primary model at the moment. We are out of network or fee for service. So you pay as you go. An annual exam costs about $500 in our office. So if you see me just once a year, that's what you pay. And we give you a receipt. You can submit it to your insurance. And if you have a PPO, many insurances will actually reimburse you for that, or you can use HSA, FSA, whatever. So that's how we work. So we are not concierge. We do not require an annual fee, and you just pay for your visit. Okay. Okay. And lastly, number 3, a myth is that we have a poor referral system. Okay, so this is a myth. Many patients think, well, if you're not part of a big system and I see you for GYN care, but then I need a general surgeon, or I need a GI doctor, or I need dermatologist, I need somebody else, I need a referral from you. You're not going to be able to refer me to anybody because you don't belong to a system. You're by yourself. You're a private practice. So this could not be farther from the truth. Okay. So I've worked in both. I've worked in corporate medicine. I've been part of a big system, and I've also been in private practice, and big systems have their perks, right? A lot of, you can see notes from each other from different specialties, but it does not mean that you have better access. Patients come to me from bigger systems and tell me, oh, I was referred to a gynecologist in my system, but I can get an appointment with her for 3 months. So I'm just going to come to you, right? So we have excellent referral partners who are private, who are in private practice, who are in concierge care, who are in big systems. I have great relationships, excuse me, with doctors and different specialists from all of these places. I have many of their numbers on my cell phone. And so like that patient who saw me, with her breast lump, I was like, okay, you need to see a breast surgeon. I'm not typing in a referral to a breast surgeon. I'm calling my friend who's a breast surgeon and saying, hey, can you please see my patient ASAP? I'm very concerned that she has breast cancer. So our referral system is very robust. We have great connections, and when you come to this kind of practice, you're not just coming to see me or Dr. Christensen, who's our other doctor in this practice. You're kind of buying into your network. You're tapping into our network, and that could be, a huge life-saving moment if there's a problem. Okay, so again, as I shared with my first story. So if you're just joining me, you definitely want to hit the replay and listen to my story that I shared in the beginning about my patient who was diagnosed with breast cancer, okay, and how we were able to help her navigate everything quickly. So that's the value that we provide. So I just wanted to break down these myths, because in the almost 3 years that I've had this practice, these are common sort of objections that people have had to coming to an out-of-network practice. And so I want you to just listen to this and just, digest that. So number 1, first myth is you have to be rich. Not true. Okay. You just have to value your healthcare. Number 2, you have to pay a large annual fee to be part of this practice. That's not true. You pay just as you go, and an annual exam is about $500. So if you want a one-time visit, that's all you pay. Okay. And number 3, the third myth is that our referral system is poor, and that's not true. We have an extremely well-connected system where we can get you in where you need to. Way faster than your average, medical system. So I wanted to break these things down for you guys. And we have been, I'm just so grateful to all of the patients who have trusted me with their care over the almost 3 years that we've been open in this practice. And I'm so excited for our next chapter. We are moving to a space just around the corner. It's going to be right in the heart of Lafayette, California, and we are doubling our space. We've hired Dr. Christensen, who is an amazing gynecologist, endometriosis specialist, and a surgeon like myself, and also a lifestyle medicine doctor. So she is extremely passionate about providing holistic care. So we are expanding our space and our capacity to serve more women. We have, as of today in this practice, we would have served 1,344 women since we opened our doors on October 3rd, 2022. So it's just a real testament to, what can be done in medicine when we just take a bold step and do something a little bit different. As I prepare to make the move, more and more private practices are closing around me. There's one or two private GYN practices, and one of them is also, closing down. And so women are left with fewer options, which is really, not ideal, because we take care of so many people around us. We take care of our families, our communities, and yet, we have to take care of ourselves first, because that's how we can pour out to others. So if you're somebody who values your health, come and see us at our new space. We'll be starting to see patients there July 7th. Dr. Christensen's panels will be open Thursday, Friday, and I'll be working the other days. And please follow us on social media for all the updates. And it's going to be a really nice, cozy space. We'll be announcing a lot of new programs that we're going to be unveiling in the fall. We'll have a big 3rd-year anniversary party. I'll post details on that. Would love to see you guys there. And okay, so now I'll take questions before I go to see patients. So, okay, Safa Warrior says, so excited for your new practice, and thank you for charting the cash pay. Yeah, absolutely, you're welcome. The other huge benefit for another population is people who don't have insurance. People are like, I don't have insurance. I don't, I just want to pay and just see a doctor and get the care that I need. I don't want to pay for insurance, and I don't have insurance. I actually called a practice to ask them what their price was for cash, and I was like, hey, if I'm a patient without insurance, how much will you guys charge me? And they didn't know the answer. The front desk had no idea. And they were like, honestly, we don't know. So, if I was a patient, if I went to that practice without insurance, I would be going without knowing how much I was going to pay. I would potentially get a bill for, I don't know, $2,000. Who knows? I have no idea. And I would be in and out in like 7 minutes. So thank you for mentioning that. Yeah, so for patients without insurance too, we're a great option. Any questions or other comments that you guys have? No one? Yes, sharing information about cash pay and how that works. I think more and more doctors are moving this way because we're all sick of insurance systems. And I think patients are sick of it too. I had a patient yesterday who traveled from over an hour to see me, and she said, I would rather just come here and pay cash, because even though I'm using my insurance, my out-of-network cost is more than what I'm paying you. So she's like, it makes no sense for me to actually use my insurance. I'll just pay cash. So this is unfortunately the truth. We're all paying a lot for insurance, and yet, when we go and get a test or see a doctor, we're then paying more money on top of that, which makes, really, it doesn't make any sense. So I think more doctors are doing this. And if you're a doctor, who's watching this, this is possible. You've trained years and years and years to be excellent at your craft. We've all gone to school for over 12 years, right? Like, I've trained for 14 years to do what I do. And we have spent an enormous amount of time to do that. And we want to be able to do it in a way that makes sense for us, right? So it is absolutely, absolutely possible. Thank you for being a doctor that takes time and listens. I refer you to some of my friends as well. Thank you, Molly. Thanks for watching. I love it. Appreciate it. Appreciate the support. You're amazing and so knowledgeable. Thank you, Doc. Emblith. Thank you so much. She's another amazing gynecologist. Can you do ultrasound for early pregnancy? Yes. So we are gynecologists. We don't do a lot of obstetrics, but we do have ultrasound. We can do ultrasound for early pregnancy. A lot of times patients find out that they are pregnant, but then they can't get in with a doctor to confirm their pregnancy. So you can definitely come here and get your ultrasound. Yes, some practices don't see pregnant patients before 12 weeks. But, if you're pregnant, you are anxious or nervous. You're like, is my baby okay? Is this a viable pregnancy? Is this really happening? You're excited, you're nervous, you want an ultrasound. Absolutely. You can just come in here and we will do that very quickly for you. So as early as 6 weeks, we have patients coming in, and then we can help you with some referrals too for other good obstetricians in the area. That's a great question. I'm just hopping on. How are patients charged by the hospital and anesthesia? Excellent question. So for in that case, we, when we operate, when we do a surgery, we do it in an in-network hospital or facility, and they can charge the patient's insurance. So you can use your insurance for surgery, anesthesia, hospital stay, all of that. When we talk about out of network in our practice, we're really just talking about our services that we provide here in the office. So all of the other big stuff for hospitals, you can use your insurance for. So yes, that's a really good question. I went to 2 GYN practices yesterday with multiple physicians, but they're overwhelmed and wait times are long, as you said. Yeah, we see that all the time. I actually have a lot of patients who have gynecologists, right? So they're not like patients who are just floating around without any care, but they can't get in. So, they're like, we have this problem and we don't want to wait until September to be seen. And we also don't want to go to the ER where we're not going to see a gynecologist. And so, yeah, this is the problem. We need access. We need access because, again, if you have a breast lump, nobody wants to wait for 3 months to figure out that is cancer, right? Like, no, that is just not right. And think about all the anxiety that it causes women, right? I have people coming in here with all sorts of things that is creating so much anxiety for them. And as a gynecologist, when I see them, I'm immediately able to reassure them often that this is nothing to worry about. And they're so relieved and so grateful that they were able to get in. But, they don't want to go on that vacation or that cruise knowing that they have this problem, and they just want to know, is it something to worry about? And that's the kind of reassurance we can provide. And really, there's no dollar amount you can put to reassurance and peace of mind. That is really, you'd pay a lot of money for peace of mind and reassurance, right? So any last minute comments or questions? Thank you for being so transparent. Absolutely. I think that's one of the problems in our healthcare system. There's no transparency and just the way it's built. And doctors want to do their best in these systems. They're excellent doctors. They're trained so well, but even they don't know the answers to these questions. When people would ask me, hey, how much does an annual cost? I'm like, you know what? I don't know. I don't set those prices. I have no idea. No, higher management doesn't tell me what those prices are. And doctors are working really hard, and even they don't know how much money they're bringing in or what their compensation is going to look like at the end of the year. It's really disturbing. And so that's why I think we'll see a trend and a shift towards privatized medicine, private care, and just, pay as you go, which is what medicine used to be, by the way, 30 years ago. So it's kind of making a full circle. Couple more minutes. Dina is awesome. Yes, Dina is awesome. She is a star. I love it. I'll have to take a picture of this and send it to her because thank you for saying that. Our staff work really hard, and Caroline and Dina and Gustine are our medical assistants, and they always pick up the phone. We don't have an automated, system or like a phone tree or press 1 for this, press 2 for that. We don't have that. We have a live person who always picks up the phone and can talk to you. And it's just, really just feels like a family, and it just feels more comfortable. And so, yeah, thank you for that comment. Do patients know the exact cost of surgery before, or is it more of an estimate until after the complexity of the surgery is realized in the actual OR? So from our perspective, it's pretty straightforward. We give the patient the exact cost of the surgery, and I kind of estimate how it's going to be. Sometimes I'm surprised. Sometimes it's a much harder surgery, but we don't go back and say, hey, it was harder, now you pay us more. It kind of all evens out. As far as the hospital, they deal with that separately with the patient. They give them their estimates and their, fees. So they deal with the hospital like they would do with, any other physician or system. All right. Yes, good staff is absolutely critical. Definitely. I'm so grateful and lucky for good staff. All right, guys. I am seeing a full day of patients today. Really excited to be opening our new space. Please, call for an appointment if you're somebody who is excited about this kind of care. Join our email list. You can go on our website, lamorinda.gyn.com, scroll all the way down to the bottom and just put your email in. We'll send all the updates through the email list. We don't bombard you with emails. We send only 2 emails a month with kind of the latest of what's happening in our practice and, any updates. We're going to be, unveiling some new programs this fall, so stay tuned for that. And share this with your friends. If your friends have been complaining about not being able to see a good gynecologist and not being able to, find a good doctor, definitely share this with your friends, colleagues, and thank you to everybody who has been watching this series and engaging with us on social media, and of course to all our patients who are already a part of our incredible community. Thank you, everybody. I will see you next week. Bye.